Hi everyone, it's Jennifer Kravis here, one of the Lyme moms here at the Ottawa Airport with Sue Faber. I'm going to have to use my notes today because I'm a little tired, but we wanted to give a really full update of our meeting with the Health Minister, Jane Philpott, as well as Dr. Teresa Tam, who's the Chief Public Health Officer at Public Health of Canada. So that occurred yesterday, and we were very, very appreciative to have the opportunity. It is not easy to get in to see a minister who has an extremely busy schedule. We had two goals going into the meeting. First and foremost, it was to communicate the truth of the patient experience across Canada, which has been undeniably communicated through the thousands and thousands of letters and petition comments. And secondly, our goal was to communicate to the minister that we hope we can become a trusted resource to her, and that we can engage with her office on an ongoing basis. That for us, we wanted this to be the beginning, not the end. We feel the meeting went really well, and we actually feel like we accomplished both. Minister Philpott was very gracious. She was very warm, she was welcoming, she listened very intently, she was very engaged. She thanked us for the work we have done, and she said she thinks it's very important. We spoke very candidly to the reality of the intense suffering, the abandonment, the financial devastation of Lyme patients and their families. We raised the fact that Lyme patients are having their medications seized at the border as a very critical issue, and the minister committed that her office would look into this. We will definitely follow up on that. We raised the denial of treatment, the inability of patients to get consults with infectious disease specialists, such as my daughter, who's waited 15 months and no consult has come. The abuse of Lyme patients within the medical system, the fear of families to go to ER or to see doctors, the lack of understanding or education on Lyme and co-infections, both among medical professionals and among the general public. We talked about concern about alternate modes of transmission, specifically congenital and more. We highlighted the possibility that undiagnosed Lyme and co-infections, could they be a contributing factor to skyrocketing rates of mental health issues and chronic disease among First Nations and Aboriginal communities. This is clearly a federal responsibility. We handed over a very thick stack of research, thanks to Sue Faber, on congenital Lyme disease, 4 bound volumes, and we said we look forward to having it all included in the literature review that Public Health is currently conducting on the subject. We raised the fact that there's a massive waste of healthcare dollars and social and economic burden from so many disabled Canadians from all walks of life and professions. We talked about the high rates of suicide, the desperation, the feelings of marginalization, the despair and abandonment. We spoke quite a bit about the children. We showed some of the pictures, and we spoke about, doctors sometimes ordering them to walk and not treating them like they're faking their symptoms. We talked about the inappropriate labeling of children with psychiatric disorders and the pressure on parents to commit them, and as well threats against parents of children's aid investigations if they do not comply. We talked about how we have Canadian scientists, clinicians, and long-standing advocates with expertise that are not being engaged right now as resources for solutions. Sue did a great job. She read from the letters. She shared some of the pictures. She gave specific examples of the injustice, and she spoke very passionately and very eloquently and really from the heart. The minister and Dr. Tam both listened very intently. They showed concern and compassion. The minister acknowledged that she is aware that there is intense frustration and emotion among Canadians and that there is so much to be done. She specifically referenced the fact that education of the public so that they understand the risks themselves and that they need to know what to do if they're bitten by a tick or develop symptoms is a high priority. Our meeting was very short. It was actually about 20 minutes because the minister is very busy and had to rush to another meeting. So there was simply not time to really delve into any of these issues in any detail. But our goal was simply to put them on the table and to raise them. And we left behind a sheet with everything written on it. We felt that we did a good job, that we were able to actually cover so many issues in such a short period of time, as well spoke clearly about the letters. For us, the best and most successful outcome of the meeting was that the minister did indicate that she would like for us to have an ongoing collaboration with Public Health and also with her own staff. For us, that was a huge win. And we sincerely hope that this can be the beginning of an ongoing relationship and dialogue and an opportunity for us to have input and to bring the patient voiced experience to her in her office and hopefully be engaged in solutions. We look forward to continuing the momentum, and our goal is to continue to represent Canadian voices, which so desperately need to be heard and acknowledged. Both Sue and I count it a huge privilege that we have been entrusted with your stories, your heartache, your personal anguish, and your pleas for help. And having read so many of the letters, we have shared your tears and your pleas for help. We know many Canadians are in crisis and that change cannot happen fast enough. And we wish that we could tell you that some miraculous change is going to happen instantly, but we all know that that's just not the way the government works. It's a long process. But we can promise you that we will continue to do everything in our power to advocate on your behalf and our own behalf for that change. Until all the issues in the Ticking Lyme petition are addressed, we continue to encourage people to sign it, to share it, and comment, because we think it's so important that all Canadians are aware of the risk and what's happening, and we need many, many more Canadians to rise up with us to put pressure on the government to continue paying attention to this disease and to bring serious change. Thank you again. We could not have done this without your support, your letters, your participation. This truly has been a great shared effort, and it's meant so much to us to have your messages of support, and we hope that we have done your letters justice. We think this is just the beginning, and we really believe that the best is yet to come. So thank you.